Yeah, a tummy tuck or abdominoplasty is one of the best procedures around. The people who are candidates are probably the largest population are women who have gone through childbirth. You know, certain things happen to the body during childbirth that no matter how much the woman exercises, they can't fix. And that is that the abdominal wall muscles get stretched, the rectus muscles separate, and then there's lax skin of the abdominal wall. Probably the next largest group, which is increasing all the time, are those people that have had their gastric stapling procedures and have lost a lot of weight. And despite their weight loss and increase in muscle mass, they'll have a lot of excess skin. So in a tummy tuck procedure, we do is we make an incision across the lower abdominal wall, and then we elevate up the abdominal skin and fat, cut it free. We leave the belly button where it is. We lift up all of that skin and fat. And then once that's up, we take those underlying muscles and we tighten the anterior abdominal wall to pull those muscles together, sort of. You can imagine this as sort of an internal corset or tightening of those muscles. And then once we have the underlying framework sort of back to where it was, and we take and pull down the excess skin and remove the excess skin, it's not a procedure that is. It's not a procedure that should be taken lightly. It does certainly have its associated downtime. It's very hard to rush that downtime. We put drains in to have the skin sort of stick back down in its new place. Those drains are in there, say, 10 days to 2 weeks. And once the drains are out, I would say the patient is really pretty mobile. We do encourage patients to start moving right away and to start getting around. They're restricted in terms of heavy lifting and doing anything that might stress those internal sutures in the abdominal wall sutures. But again, typically recovery, I would say, would be anywhere from 2 to 4 weeks. To recover the full or complete amount of energy, maybe 6 weeks or 8 weeks. The maturation of the scar will take anywhere from 6 months to a year until you see the final end result. And nowadays, we're able to put the scar in a bikini line or an underwear line or wherever the patient desires. I stress that to the patient ahead of time, so when they come in to be marked, they wear in their bathing suit bottom that they would like to have that incision hidden behind. And then they're marked in such a way that we can keep that incision low and hidden and underneath their clothes.